On January 25th, 2020, Canada reported its first case of COVID-19 in a Toronto man who had just returned from Wuhan. Dr. Jerome Leis at Sunnybrook Hospital treated patient 0 after he came in for a mild case of pneumonia. He joins us this morning for more on that fateful day. Good morning to you, doctor. Thank you for being here.
My pleasure.
Okay, so walk us through. When the patient came into the hospital, what made you suspect it was COVID and not simply a regular case of pneumonia?
To tell you the truth, we knew when we looked at the chest X-ray, the patient had already screened positive. We had a screening protocol in place for return travelers. Wuhan had been identified just a few weeks before as an area of concern, and they had compatible symptoms. But it was really when I looked at the chest X-ray, the emergency physician at the time, I remember reviewing it with him, and we both immediately knew. And then at that point, it was just a matter of managing him and obviously confirming the diagnosis. So we decided to admit him. As it turned out, he ended up not getting as sick as some of the earlier reported cases out of China. And so he certainly had the milder spectrum of COVID pneumonia.
Last January, we didn't know as much as we do now about the transmissibility of the virus. So when the lab confirmed his diagnosis, were you at all concerned you or any member of your staff might get infected?
To tell you the truth, obviously that was the paramount concern around the management of the first case, and every case since it has been to be able to contain this virus, keep other patients safe, and keep our healthcare workers safe. And this first case really set the stage for being able to do so safely and manage these cases safely. We had a protocol in place and managed the patient and the appropriate precautions, and we didn't see any transmission to other patients or healthcare workers, and it was truly a team effort from the paramedics that identified the patient in the field. Our triage system worked in identifying them, placing them in the appropriate precautions. The emergency team, the admitting team, nurses, physicians, environmental service staff that turned over the room. We made sure we cleaned the environment adequately to ensure that we would avoid any spread to other patients. And you're right, Ben, we didn't know how it was transmitted, so we took every precaution.
So this patient, as you said, was one of the first cases in the world to report a milder case of the virus, which you say you were not aware of at the time. But how did it help teach you about the larger spectrum in terms of disease severity?
That's a great question. We learned a ton from this first case and from the cases that followed before it actually became officially a pandemic. The reference point before that was SARS-1, which was really a more severe viral infection where patients became more infectious when they were in hospitals. We approached this case with sort of assumptions that might be the case. And you're right, this patient didn't end up really declaring themselves as a more severe case, and so it was one of the first cases reported in the literature around COVID pneumonia that doesn't go on to more severe outcomes. And certainly, I think that was sort of a warning, probably, that there were less severe cases out there, and we were probably underestimating the global case counts at the time.
Doctor, experts warn that there will be more pandemics in the future. So what have you learned from this to prepare?
Well, it's certainly been obviously a very challenging year. I think the greatest challenge has been coordinating the pandemic response. Right, a pandemic brings with it so many different layers of challenges, and within a hospital we have protocols on managing patients. Helping our staff, but really beyond our walls, in a pandemic, there's so many different challenges. Coordinating that response between the health region, with the Ministry of Health, with public health, and different layers of government, municipal, provincial, federal. I think coordinating that response is something that has been a challenge throughout this pandemic. I think there have been some improvements throughout it, and actually hopefully some transformative changes, but I think we still have some ways to go in order to coordinate that response across Canada.
Dr. Leis, I wish there was a way for us to show our appreciation besides saying thank you, but unfortunately, we're going to have to leave it there. You have our respect and our appreciation, and all the best to you and your family.
Thank you, Ben.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.